Is running or lifting weights, especially exercises like squats, are these bad for your back? In this video, I discuss the potential risks of these types of exercise on the back and lumbar spine injuries. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my YouTube channel. Now, here's a question that I got recently from a viewer. I've been training for a 10K. I'm 58 years old. I was running every third day to allow adequate rest, but doing weights the next day to build joint and muscle strength. I had a sudden pain in my lower back while starting a 5-mile run that stopped me instantly due to my back seizing up. I ran a quarter of a mile when it struck, but had run 5 miles 3 days earlier with no problems. I think the jarring of running affected my back much like the jarring on a knee, especially since 2 days prior I did squats. Can you please provide a video explaining how running potentially affects the lower back and could be the cause of severe low back injuries related to running? I had no idea a person could strain their back from running. By the way, the squats were only 100 pounds, which isn't typically an issue for me. Now, before I answer this question, as always, in all these Ask the Doctor videos and all the videos on this channel, this is not meant for medical advice. This is only meant for information and educational purposes. Now, whether or not definitively he injured his back doing the squats or running, we're not going to know. I mean, in theory, yes, all right, no problems, and you take a sudden step. Typically, though, especially when you're talking about somebody in their 50s, 60s, and older, they already have some wear and tear and early degeneration of the discs in their back. If you look at, say, this model of the lumbar spine, in between the vertebral bodies, you've got discs, and those typically wear out over time, with age especially. Now, that can be related to an acute trauma, but much more often it's related to wear and tear over time. Could running do it? Potentially. There are some studies that show that the axial load, and that basically is compression in a sort of vertical plane related to gravity, but also things like weightlifting where there's downward pressure, squats, military presses, things where the weight is pushing down on your spine, that increases the risk. It's not just running, it's not just weightlifting that would potentially cause those. There's all kinds of physical activities. There's all kinds of work-related activities that can do that. That's why manual laborers typically have a higher risk of lumbar spine degenerative conditions than people who work desk jobs. Same thing with high-level athletes. Same thing with bodybuilders and power lifters. Same thing with members of the military. So all of this is potentially an issue. But I will say, if you're watching this and don't have back injuries, don't stop running. Don't stop lifting weights out of a fear that over time you may develop lower back issues. That there are plenty of runners, plenty of weightlifters, or people who just like to do those recreationally. They're not even full-time, that don't have lower back issues and don't go on to develop lumbar spine injuries. So it's just something to potentially know about. If you already have lumbar spine issues, then again, I wouldn't say stop running or stop lifting weights. You just might modify it a little bit, especially in the weight room. You just might choose, say, leg press instead of the squat more often than not, things like that. That's not a blanket statement. Everybody's a little bit different. Sometimes a physical therapist can work with you and more specifically modify your workout routines based on the nature of the condition. But having said that, yes, the axial load, the repetitive impact, and the weight from things like squats, especially increasing the axial load on the lumbar spine, bones, and discs, in theory could increase the risk of degenerative lumbar spine issues over time. Now, if you want a copy of my ebook, The Arthritis Solution, you can get it by clicking the link in the description below this video. And if you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, also click the link in the description under this video. Fill out the contact form to schedule an appointment with me. Also, I'd love to hear your experience with your injury. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice, but like I did here, I might answer your question in a future video. Make sure to subscribe to my channel and click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.